Welcome to episode 6 of Gateway Gatherings with Dr. McGuire. We are thrilled to have you join us today. This is the show where we bring together amazing people to share insights, stories, and tips to help you live your best life. If you enjoy this content and would like to stay up to date on more, simply like and subscribe to our channel. Thank you and enjoy.
All right. So, hello everybody. Welcome back to another episode of Gateway Gatherings. I am Dr. Alika McGuire, and I'm excited to have you all here with me. We have a special guest joining us, Allison McCarthy, a physical therapist at Cora PT in Brentwood. Yes?
Yep.
Yes, Brentwood. Allie has been helping people improve their mobility and recover from injuries for years, bringing a wealth of practical knowledge to our discussion. At Cora PT, Allie works with a variety of patients from athletes to everyday individuals dealing with pain or mobility issues. Her approach is all about personalized care and effective recovery strategies. And despite the misconceptions that chiropractors and physical therapists are at odds, the truth is both professions excel individually and can be even more effective when combined. By collaborating as Allie and I have, we have been able to provide our patients with a much more comprehensive approach to care. And by combining chiropractic with physical therapy, we are able to achieve better outcomes. Today, we're going to talk about some useful tips for preventing injuries, staying active, and how our collaborative efforts can enhance recovery. And we'll also have some time to answer your questions if you folks have any. If you folks have any questions, please just type them into the chat and we will get to them as soon as possible. All right. Let's give a warm welcome to Allie. How you doing today?
Thanks. I'm
All right.
well.
Good. Allie, can you do me a favor? Why don't you briefly introduce yourself and share your story?
I'm Allison McCarthy. I am a physical therapist. I also manage the clinic that I work at. I have been a PT for 15 years, and I have a master's degree, which means I'm older. The kids now have doctorates. What else is there to tell? I have some specialties that I use in the clinic that are a little bit different, so that's cool. And yeah, I like to treat all levels of people, from sports specific to elderly, just not babies.
Why don't you tell the folks what inspired you to become a physical therapist?
I always wanted to do something that would help people, and I guess I didn't really know what it was, or I didn't really care what it was. Honestly, I just wanted to help people. And so I played a lot of sports, and my parents thought that maybe I would be good in physical therapy. So I did some shadowing and decided that that's what I wanted to do. And so I applied to one PT school, and it's a good thing I got in.
Tell me the process, right? So you got into PT school, right? You're going in, you're learning. Tell me how it was after you graduated when you got into the field.
I remember feeling like I knew nothing when I first started as a PT. I would listen to other therapists as they were talking to their patients, and I would just absorb everything like a sponge to be able to hear how they were rationalizing people's symptoms to them and educating. And I felt like that was the most important piece that I could capture from people that I was working with. Mm-hmm. And slowly I built my skills and my confidence, and here we are today.
Yeah. You didn't start out as the clinic manager at Cora. Kind of tell us how that has evolved over the last 15 years.
Yeah. So I was working for a company called Physical Therapy, Spine and Sports Medicine at the time, and Cora bought us in 2019, and it was a great move. They spent a lot of time trying to figure out what company they wanted to sell their business to, and so that we could grow. And at that point, they wanted to open some clinics in St. Louis, so they asked me to open one, and so I got to kind of build it out the way that I wanted and manage it and hire who I wanted, and so it's my baby, and I love it.
Oh, that's wonderful. I didn't know all that.
Yeah.
I've seen your clinic. I love it.
Thank you.
It's really cool. Yeah. It's small but mighty.
Yeah, for sure. And it doesn't
Um,
have like a sterile like hospital vibe, you know. It's got
yeah,
warmth and fun and
absolutely. Yeah,
yeah.
that's another thing. It's not just this, boring, like it's a place where people like you feel actually welcome
Yeah.
in it. Cool. Yeah. Wow, that's great. I didn't know all of
Yeah.
that. Um, what are some common misconceptions that about physical therapy that you often encounter?
I think maybe a common one would be that they're going to hurt worse when they exercise or when they do things. Um, but we just educate that most of the time, the issue that they have stems from some sort of stiffness. A lot of times, it could be weakness as well, but a lot of times it's stiffness in like our older population, and then they're the ones that need convincing, you know, that I'm not going to hurt them. And like we just get a little bit of motion in their joints and their body, and they start to feel better. And it's,
Mhm.
you know, that's the
Yeah.
beginning.
Yeah. I guess another thing too, right? Now, somehow you and I have figured out how to work together without competing against each
Oh,
other, right? And I feel like oftentimes, especially on social media, I see folks saying my back hurts, and there's a long list of comments that saying go to physical therapy or go to chiropractic or don't go to PT, don't go to chiropractic.
yeah.
Um, why don't you, for the viewers today, like differentiate what is a physical therapist, their focus, and I guess what would you say is the focus of a chiropractor? How do you differentiate yourself from the two? Speaking to a chiropractor.
Yeah, for sure. Well, like in PT school, we're trained to manipulate the spine. But one, I don't feel comfortable with it. And two, I don't do it day in and day out. Like that's not what I do every day, all day. So I highly value you guys, you know, chiropractors, to be able to manipulate those joints that need to be manipulated. And what I see the most is probably like rib heads that are out. And that's something that I don't want to deal with. Like I'll deal with the muscular aspects of it, but I feel like you guys are just very like skilled in putting things back where they're supposed to be. And so I use it a lot for that. And then physical therapists, our job is to then balance everything so that it stays where it's supposed to be. Whether that's like strengthening the shoulder blade muscles and improving the posture of the joint so it doesn't keep coming out of place. Um, so I think that's how we work really, really well together.
Yeah.
In my opinion.
Are there any situations that you come across where you would rather them be treated by a chiropractor and vice versa? Where would you not want them to go to a chiropractor? And I've got an answer for that too, but we'll wait for yours.
I mean, there's certain places where I don't know that I would use a chiropractor. Like, I don't know, maybe like a rotator cuff repair, like a fresh surgery or something. I don't know. I use them like a lot for like putting things back where they're supposed to be. So if I feel like a vertebrae that's not where it's supposed to be or something, but maybe like an ankle sprain that just needs a lot of stabilization. I don't know. But I use it a lot for the spine. You guys for a lot for the spine and the ribs.
What about a situation where you would maybe not want to, maybe that you would think the chiropractor would be better suited, or something that you probably wouldn't feel comfortable treating, that you would rather have a chiropractor?
Like I do not deal with the sacrum. That is like not my area of expertise. But I feel like you have really like studied that and you're very good at it. So like anything in like the really low back, kind of like sacral area, I feel like you really do a good job at, and I would 100% refer that out.
Yeah, I'm pretty good. Yeah, I'm pretty good at the sacrum. One thing I will say, so there are a few main reasons why I will send someone to a physical therapist, right? There's a lot of different things, and obviously we work, when you put the two and two together and you find two people that work really well together, like outcomes become better. But there are like I would say four main reasons why I'm going to send someone to the physical therapist. One is they don't know what to do, how to do it, and they need guidance and education, something I don't always have time or patience for, or the knowledge for, right? I'm not a physical therapist. I don't know massage or, different exercises to isolate the lower trap or whatever. The other one is they know what to do but won't. That's the other good one. Then there's I don't have the toys available, right? I don't have traction. I don't have laser. I don't have ultrasound and those therapeutic devices. And the other one is oh gosh, I had it in my head and I forgot it. Well, those are the three main ones.
For sure.
Or just something. Actually, the other one is like situations in which I cannot safely adjust somebody. There are situations, like certain cases of osteoporosis, right? I cannot do a regular chiropractic adjustment. I have to get creative, and oftentimes they need physical therapy. There's also a situation. I had a patient walk into my office just a few weeks ago, actually, who at one point had Harrington rods that had to get removed because of spinal infection. So that spine is fused. There's no manipulation that I can do that's going to introduce motion into those joints. So that's your job to do that.
Yeah,
so,
happy to help.
those are just some situations. Conversely to that question, how do you see, in what ways do you see chiropractic and physical therapy working well?
The way that I use it, I feel like works really well. And that, if there's something I don't feel like I can address, that I send it to you and we kind of work together at the same time. Like, it's not something that we need to do, like, wait till you're done with physical therapy to go to the chiropractor, or, go to the chiropractor before. But like, I really like when we can work together at the same time, so they can be,
That's something I'm curious. That's something I've heard in the office. I have heard chiropractors or not chiropractors. I've had heard of physical therapists telling my clients not to go to the chiropractor while under active physical therapy treatment. What would you like? Can you? I mean, I think that's bullshit. But like, can you speak on that?
Yeah, I mean, that doesn't make any sense to me, because why wouldn't you want extra hands, like helping the person to get better faster? That doesn't make any sense. So I don't understand the rationale at all.
Yeah,
on that one.
Yeah,
but
to me, it doesn't make sense. One thing's for sure is like I like to stay in my lane. I'm not a physical therapist. I don't do massage. I don't have toys. I have these two hands here are my tools that I use to adjust, that I use to treat patients. And I'm an expert on the spine. I'm very good at it. I'm really good with joints. And when it comes to the physical therapy, I understand that, the muscles that move the bones are attached to the bones, and they can be stuck, and they can be misaligned, and they can be out in many different ways that are going to affect both, right? So a tight muscle pulling a joint in weird directions, or the subluxation of the bone affecting the muscle, right? Both are very important in treating, and to me, it doesn't matter which one caused which. We have to do both, right? We have to adjust the spot, we have to adjust the area, and we have to strengthen the muscles to stabilize the area as well.
Agreed.
So like, I don't understand when I hear go to the PT, go to the chiropractor, or don't go to the PT, or it's
probably
just
the same kind of people that are like, stop doing the activity that you love, and that bums me out.
Yeah.
I'm not that person.
Yeah.
I'm not going to say like, stop riding your bike, or stop going to the gym, or stop, like, we're going to find a different way to like modify or change your activity and educate on what it is that's bothering you so that you can keep doing what you're doing through it all. You know, like it's very rare that I'm going to say like, stop doing what you're doing, you know?
Yeah. I say it as a joke, right?
It hurts when you do that?
Yeah, it hurts when I say, don't do that. It hurts.
Yeah.
But that's what, again, you know, that's why I love working with you, because that's what I tell my patients. You know, they say it's not my job to stop them from going to work or doing the job that got them into my office in the first place. It's not my job. I'm not trying to stop them from playing sports. I'm there to just make sure it doesn't wear you down faster, because you're going to do it anyway.
Yeah.
Because you got to pay your bills, you got to, you know, you got to take care of your kids, mental health, whatever, physical health, like it's what you have to do. So you do that. I'm going to make sure you can do it forever.
Yeah, for sure.
Yeah. So I know a lot of folks here probably are dealing with some type of injury, whether it's some back pain, some shoulder pain, some type of aches or pains. What are some of your top tips for preventing common injuries?
The first one that comes to mind is probably hamstring stretching. I feel like anybody who has tight hamstrings, it doesn't bode well for their back, you know? Yeah. So stretching hamstrings, I feel like, is probably the first thing that comes to mind.
How does someone know that they have good hamstring flexibility?
If you can lie on your back and put your leg straight up in the air, I think that that's probably the minimum of like what I would consider normal.
So lying on the back, 90 degrees up in the air.
Yeah.
I agree. That's a good one. What else?
For preventing injury, probably postural strength. So a lot of us like sit like this and we do work like this on our computers. So I treat so much of like neck and shoulder problems because of that. So I think a good preventative is shoulder blade strengthening, middle trap, low trap, rhomboid, and not just like the kind where you're doing like rows, you know, because that gets like a ton of muscles. But like we're talking about isolating, you know, the middle trap, isolating the rhomboid, all the little muscles of your upper back that pull your shoulder blade back where it's supposed to be. So that's what I would say.
Those are big. When I was in chiropractic school, we had one of my teachers, Dr. Zilke, I think that was his name. He was a DC PT, and one thing we had a class where he went through all the PT exercises, and I think I was running out of like steam. I couldn't listen because I was just having a hard time. I wasn't interested in it. And he said, Doc, if there's 3 things you can tell your patients to focus on, it's thoracic extension, hip mobility, and ankle mobility. If you can maintain those 3, your body, your elderly patients, or your body will thank you when you are elderly.
For sure.
You can maintain those 3 things.
I agree with that. I want to be able to like do a full deep squat for my whole life.
Yeah.
And just like hang out there, you know, like to do an activity, like pull weeds or whatever it may be. Like that's just something I feel like maintaining that mobility is super important. Yeah.
Yeah, absolutely. And no one thinks that the ankle mobility is important, but you can't deep squat if you don't have movement in your ankles.
And that's usually like the most limiting factor is the ankle. You put somebody up on a little foam, like raise their heels, and then they can do a deep squat because they have the hip mobility, they have the knee mobility, but it's just the ankle limiting it. It's wild.
And you can't walk around with a heel all the time.
You can't.
Not without sacrificing your low back in the process.
Right. And your feet. That sounds awful.
Yeah. Just kind of a sciencey thing for everybody. The reason why the feet are so important. I mean, people forget about the feet, right? Because they're stuck in our shoes all day. They hurt all the time. Right. We want to focus on our feet because there are 26 bones in the foot, all of which with articulating joints, with neurons and sending information constantly to the brain. You have to keep your feet mobile. You have to. They're meant to move.
For sure. And I feel
Can
like
I repeat
they
those
don't
three things?
activate like the muscles, like for balance,
Yeah,
like that's really important, like intrinsic foot strength.
yeah, absolutely. Actually, in 2 weeks, I'm going to have, in 3 weeks actually, because 2 weeks is 4th of July, I'm going to have a foot expert on this, and we can definitely talk about that for sure.
Nice.
But someone asked if I could, someone asked if I could repeat those three things. So the main three things, or one of the main big three that you want to keep mobile as you go into your life, is your thoracic extension. That's your body's ability to bring those shoulders back and that head back. Your hip mobility, right? The hip and the shoulder are the same type of joint, right? You want to be able to keep it as mobile as possible. Now, you're not going to get the same mobility you get out of the shoulder and the hip, because you're going to have a whole different set of issues in the hip. But you want to keep it mobile. You want to be able to touch your toes, bring your feet up, your leg up 90 degrees, extend, rotate, externally rotate, internally rotate. And we can definitely talk about this at another time.
Yeah, we could go into
And
specifics.
yeah, and your ankle mobility, because so much of the neurology or the neurological information that goes to your brain actually gets transmitted through the feet. So you have to keep your feet mobile, so you can just do simple things like deep squat, or maybe get on and off the toilet, right? Those things, or on and off the couch. And then, of course, as well as to feed the brain with all these, with all the information that you have. I see we got some questions. I really like that question that I see, Chloe, and we're definitely gonna get to that later. Let's see. Any other tips for preventing common injuries, Ali?
I think it's just motion. Like motion is just, I think, the most important thing, because we just keep getting stiffer as we age. So just maintaining mobility, making sure you're not losing motion to either side, and just keep
Yeah,
mobile. Just keep
absolutely.
moving.
Maybe one day you and I can do a video about like what is normal versus abnormal range of motion.
For sure.
Yeah. So I want to talk about your clinic, because your clinic has received numerous 5-star reviews, and I want to ask you, what is it that you believe contributes to such consistent positive feedback?
I think probably the first thing is just that the people that are inside the walls really care. Like Cora's motto is to serve everyone. And we just,
Mhm.
it's easy to probably be a physical therapist and just go through the motions and be like, here's some exercises. But like, we genuinely care about people and want to get them better. And we'll do whatever we need to do to suit them. Like, say their insurance only pays for 30 minutes. If they need to be treated for an hour, like we can do that. If we need to treat them once a week or 5 times a week, we're here for their, like you said, individualized treatment plan.
Mm-hmm.
Also,
Okay.
I think like the services that we offer are probably, Cora pours into us, like keeps educating us and giving us different opportunities like dry needling and A-stem and all these other, specialties like vertigo, concussion, and I didn't have that before.
Yeah, absolutely. Definitely lots of, I mean, I've learned a lot from you, and it's cool to see, especially when we go at lunch together. I mentioned something and you're like, no, what is that? Let me sign. You're like almost ready to sign up for the next seminar.
I know, I love it. I love learning.
Yeah. Let's see. What are some special certifications or special courses that you've taken since joining with Cora?
So I think the biggest one's probably dry needling. So that's like a acupuncture sized needle that we use in trigger points. So I use it probably the most in like people's upper traps. And it's so cool. It's like 15 seconds, like you have a knot and you poke the knot with the needle and it twitches and then it resets the system. So it's like the fastest way I can get rid of like knots and muscles. So that's pretty cool. A-stem is another one. It's like a myofascial treatment that uses plastic tools to like kind of scrape the tissue. So I use that a lot for like hamstring tendonitis or like lateral epicondylitis and things like that. And then the others are probably like concussion and vestibular. So being able to treat vertigo and I treat a lot of car accidents, people who's, in their brain hits forward and backward and they just are really foggy and have trouble with memory. And so those are probably the biggest ones that I've been certified in since being with Cora.
Yeah. Here's another question. And I really like this one. What is one thing you find, or what is a common thing that you find that is often missed by other physical therapists, chiropractors, other professionals, that if there are any of them on here watching right now, what would immediately make them better at their job?
Oh my gosh. Usually I get people who, they go to the doctor for their shoulder pain, and then they go to physical therapy, just some random place. They don't send them somewhere specific. And then they come back and they're like, my shoulder still hurts. And then they send them to me because they know that I'm going to fix it. So then I'll ask them about middle trap, low trap strengthening, and they haven't done any of these exercises. And it's just kind of wild to me. And that's probably the most important thing that I can offer a shoulder patient, as opposed to like more rotator cuff strengthening, it's like upper back strengthening. And that's even like with treating the neck, same deal. People are missing the shoulder blade, and there's like 17 things that attach to the shoulder blade, and they all need to work in symphony, or this thing causes havoc. Yeah. And so I feel like that's probably the thing that's most missed, is just attention to the shoulder blade, if I had to pick one.
As a volleyball player, well, one thing, if I have a complicated shoulder case that I just can't figure out what's going on or what I'm doing isn't working, I send it to Allie, because she knows the shoulder. But one thing, just as a volleyball player, I do get a lot of people with shoulder injuries, and I can't tell you how many times, like, I'm hooking up under someone's arm and I'm just grabbing their shoulder blade and mobilizing it for them. Because people don't realize that the shoulder blade has to move as well.
Yeah.
It has to move. There's 17 muscles that attach to the shoulder blade. And any combination of those 17 muscles can be affected. You have to do it. There's common ones that I can catch really quickly and I'm really good at. Outside of that, there's other times where I just send it to Allie, especially the ones that are difficult, like maybe there's partial tears that aren't surgical cases. Then I'm like, let's not ruin this anymore. Let's not wait. Let's get someone like Allie who can strengthen all the surrounding muscles around that area, so that tear, that tendon tear or the ligamentous tear, whatever damage is happening, can have a fighting chance to heal.
Yeah, that's my jam.
Yeah. So we got a really good question here. What advice would you give to future clinicians on how to build interprofessional relationships between chiropractors and PTs?
That's a question for me?
Yeah. I got an answer. I'll answer it too, but you go first.
I think it's just about finding somebody that, you mesh well with, and, that you can work together with, and that you have similar like mentalities on things. Like you and I both aren't going to stop somebody from doing something that they love. I'm not going to stop them from doing chiropractic. You're not going to stop them from doing PT, and we can work together, and just communication between practitioners, I feel like it's just really invaluable. Like but I guess the way that we built the relationship is just from a mutual patient.
Yes.
Yeah. So, I talk to patients about their chiropractors, their, primary care doctors, even if it was like an orthopedic that sent them. And I try to like reach out and meet, the different providers so that we could like collaborate and provide the best care for that patient.
Yeah. Definitely. For the person that asked that question, I'm always asking my clients who see other doctors, I'm like, who do you go to? And, and I ask them, do you like them? Right. And Allie and I have a mutual patient. And I just, she was like, hey, who's your PT? And she goes, oh, it's Allie. I'm like, do you like her? She's like, yeah, cool. Give her my card.
Yeah.
That's literally what I said. I handed a small stack of cards to the patient, and I said, at your next visit, tell her I said hello, hand this to her, and then give me a stack of her cards as well, because I need good people to work with. And from there, you can pretty much tell what that relationship is going to be like, because patients will get excited about handing stuff like that. They like sharing that information with other people, especially with people that they like. And I've had that before where the other person was like, oh yeah, whatever, thank you,
Right.
or oh, you're going to a chiropractor too, like why? Which is disappointing. It's unfortunately disappoints. It's disappointing to me, but it's also disappointing to the patient as well. So don't do that to your patients. If you
Follow up.
for those of you listening, follow up. And that's how I was able to. That's how Ali and I have developed our relationship. I've done that with attorneys. I've done that with rheumatologists, orthopedists, surgeons, all the neurosurgeons. The other way too is honestly if you're not, just don't be shy with meeting people. Like actually get out there, go to their office and just say, hey, I'm in the area. I thought I just drop off some business cards. Let me know if there's anyone I can ever send a patient to you. Like, let me know. So those are things. But good question. And Chloe.Pipkin, if you've got any more questions, you're always welcome. You're definitely welcome to stop at my office and chat about that at any point in time. And I'm sure Ali would say the same.
Yeah, for sure.
Yeah. Gosh, let's see. I have so many more questions, but we only have a limited amount of time. Ali, what is one piece of advice you would give to someone that is going to physical therapy school or wants to become a physical therapist? What is something that you would say to them?
I guess, I don't know, the school's hard, but it's worth it. I guess that's all I would say.
Yeah.
Just keep pushing. And
Yeah.
even if you get out of school and you don't feel like you know anything, hopefully you'll be able to connect with some good people and work at a company that gives you so many resources to like make you a better clinician and leader.
Absolutely. The program has changed quite a bit, hasn't it, for physical therapists?
Yeah, and like when I got to school, it was a 5.5-year program, 2 years, and now I think it's like 6.5, 2 summers straight through at the end, 6.5 years. And some of them go straight in after high school, and others of them you have to apply to grad school. So they all look a little bit different, but one thing is the same as all of them require a doctorate now.
Got it. Yes, that I knew that.
Yeah.
I knew that was kind of the situation now. All right.
Oh,
go ahead.
I thought of something else. Something that's changed about physical therapy is just that people can come to therapy without an order now. Like most of the people you send, you write an order, but just people off the street can come in and get physical therapy now, which wasn't the case,
Yeah.
a few months ago.
And
so that's
yeah, when we say, I mean, you can always go to physical therapists for whatever reason, but now you don't need an order for it to get covered by your insurance. So those things do exist now. So thank goodness too, because sometimes getting in to see an MD just to get the order to the physical therapy can take months.
It just delays everything.
Yeah.
So if you're in pain, you need to. I mean, I'd like to be seen tomorrow if I was hurting, but instead you have to make an appointment with your primary care or your chiropractor or your doctor, and then go to get an order for therapy. But not anymore.
Yeah. And I don't know if all insurances behave that way, but people can walk off the street into my office, and I will squeeze you in whenever. I had a guy schedule an appointment this morning and came in like an hour later. Yeah. Like it's that quick.
I love that. Yeah, we
all right.
Try to get people in like same day, next day. I can't have like somebody who had surgery waiting 2 weeks to get in. Like that's not gonna
Yeah.
gonna work.
Yeah. Is there anything else you'd like to share with our audience today, Allie?
I don't think so, but I know both of us are here to help anybody who needs help, even if you're not so sure about it. I'm, I'm sure you would probably say the same, but we do free screens, so people can just come in and talk with us if they just had some questions before committing to anything, and we can see if physical therapy would be appropriate for them.
Yeah, absolutely. How can people contact you and learn more about you?
So my clinic is Cora in Brentwood. It's technically in Rock Hill. It's by Katie's Pizza. But you could look up Cora and, there's a phone number there and we always answer the phone. And if, any Cora clinic, we operate the same way. So any Cora in St. Louis, you can find whichever one is closest to you and reach out.
Yeah.
You can also schedule online.
I've met several of the clinic managers at Cora. Yeah. One thing I love is that it's mostly female run.
Yeah.
I love that. It's not some big beefy dude that no, these are down ass chicks that are just real cool to hang out with.
Yeah, we got some good people that work for us, so I'm grateful for that.
So as we conclude today's interview, I want to thank Allie for sharing her expertise with us, your insights into physical therapy and its collaboration with chiropractic care. I also want to thank you personally for being so wonderful and taking care of the folks that I sent to you, because they said nothing but good things, and it shows in how they show up just simply from visit to visit, week to week. Mm-hmm. So thank you for that, Allie. Yeah. To our viewers, I want to thank you all for joining us and to remind you that prioritizing your health through PT and chiropractic care can lead to happier, healthier, more mobile, and fun lives. If you want any more information, is it CoraPhysicalTherapy.com?
Yep, probably. Or just Google Cora Physical Therapy.
Yep. CoraPhysicalTherapy.com. You can find Allie. If you want to look for me, McGuireTotalWellness.com. I want to thank you all for watching, and I look forward to seeing everybody next time on Gateway Gatherings. Thank you very much. Thanks, Allie.
Bye.